All right, so I have 19 slides here, but a lot of them are anatomy. So let's talk about, I'm trying to get the right size pen here. Let's talk about the respiratory system. So we want to talk about the anatomy and then the physiology. And the physiology I broke into lots of little slides. Now, it's important to realize that the word respiration is used lots of different ways, so don't let it confuse you, which you guys are smart enough it's not going to. So ventilation of the lungs, okay, so when we take air from the outside to the inside, when we breathe, that's considered respiration. They also call it respiration when the gas exchange takes place at the air and the blood, and there's like alveolar respiration or cellular. Then there's cellular respiration. Okay, so that's when we use oxygen when we go through the Krebs cycle. Okay. Functions. So the functions of the respiratory system are, it serves as an air passageway. Okay, so it's going to take the air from the outside from the environment. It's going to take it into the alveoli, and from the alveoli, it'll go to the blood. Okay, another thing it does is it provides lots of surface area for the exchange of carbon dioxide and oxygen. Okay, we use components of the respiratory system to detect odor, which actually helps keep us alive, because if we smell something bad like gas, it's going to get us away. And then also sound production, so our voice is they consider that function part of the respiratory system. Okay, now, how is it organized? So the way we describe it is organized two different ways, because we're anatomy and physiology people, so we can't have it be that's super simple, so we're going to do it more than one way. So the first way is based on function. Okay, so what does it do? Okay, so first we have a conducting zone. So the conducting zone is only for airflow. Okay, in the conducting zone, no gas exchange is taking place. Okay, so it's just getting air into where gas exchange can take place. Okay, so the conducting zone is considered from your nose down into your bronchioles. Okay, now the respiratory zone is where gas exchange takes place. So that'll be the smaller features, so the alveoli, the alveolar ducts, and the respiratory bronchioles. And I'm going to show you in a picture on the next slide. Okay, now we also break it up based on structure. So the upper respiratory tract is considered from the nose to the pharynx. Okay, so from your nose down to your throat, that's your upper respiratory tract. So sometimes you see doctors say, oh, you have a URI, upper respiratory infection. Well, it's in your head. Okay, lower respiratory tract is going to be from your larynx down to your alveoli. So they usually say LRI if you have and that would be in your chest. Okay, now here's a picture of what the structure looks like. So upper respiratory tract is going to go up to here. Okay, and then lower respiratory tract. Okay, conducting zone goes down to about here. Okay, and then conducting zone is any place where there isn't gas exchange. Okay, so we can only have gas exchange in the respiratory zone. Okay, and these pieces, okay, the respiratory bronchiole, the alveolar duct, and the alveoli are going to have very thin walls. Okay, so the thin walls are going to allow for diffusion. So that makes sense, right? So structural and functional. Okay, so conducting zone, no gas exchange. Okay, now the respiratory lining, okay, so the mucosa or the mucosal lining, they also call it the respiratory mucosa. Okay, so basically the mucosa is going to line everything from your nose all the way down to the alveoli. Okay, now it's important to realize what's going to happen is the epithelium is going to get thinner as we go deeper into the lungs. Okay, so it's going to thin out. I'll show you a picture. Next slide will be a picture of how it thins. Okay, now In the conducting zone, there are cilia. So remember, cilia are the little hairs. Okay. It contains mucin. So mucin is a protein that's really thick and gloppy. So the book says increases the viscosity of secretions. So that's going to make it easier to trap materials. So materials will get trapped. So if this is the mucus, okay, so in the mucus in here, okay, and then the cilia will actually sweep it so that we can swallow it. Sputum is what happens when the mucus mixes with the saliva. It's actually what we cough up. So if you're going to be a respiratory therapist, you're going to deal with a lot of sputum. Sputum doesn't bother me as much as poop, I guess. Okay, now there are certain cells in the epithelium. These are the goblet cells, and they're going to secrete the mucin. Okay, so if we look here, okay, so here's the bottom layer. It's called the lamina propria. Okay, and then the basement membrane, where the epithelium is lying. Okay, and then the epithelium. Okay, so here's the epithelial cells. Okay, goblet cells. Here's mucus, and there's the cilia sticking up. Okay. Right, so this shows you, and you'll see in lab, so this will have, so you'll also see it in lab, how it gets thinner. So pseudostratified, ciliated columnar is going to be in from the nose down to the lobar bronchi. Okay, so it's, a lot of it is this, okay. Simple ciliated columnar, that's going to do smaller bronchi and large bronchioles. Okay, simple ciliated cuboidal epithelium lines the terminal and the respiratory bronchioles, which we're going to talk about. Okay, and then this is going to be in the respiratory zone. Okay, so it'll be simple squamous. Okay, so if you think about out here, we're going to need more protection, right? So we need thicker layers. Okay, and then down here, we're getting to the respiratory zone where we need it to be thin for gas exchange. So it's a structure and function relationship again. All right. I hope that makes sense. You will have to know this, but it makes sense. Okay, now upper respiratory tract. So the nose, the function of the nose, it's to warm, moisten, and clean the air as it enters. Okay, because if you think about it, we need the air to be super clean before it hits the alveoli, which is close to the blood, right? You don't want to put bacteria into your bloodstream, so you don't want it to get to the alveoli. Okay, so it's defensive role. Okay, so it's part of your immune system. Okay, it's going to collect or trap any particles that get in, and then the cilia will sweep the particles out. Okay, now nasal septum, that's the tissue in between the two nostrils. The concha are these raised parts, and I probably said it wrong, the conchi. So these are the raised parts in the nasal cavity, and I have a better picture in a minute. And the meatus, these are the low parts, and I'll show you. Okay, so in your nose, in the lining, okay, it kind of looks like mountains and valleys. Okay, so there are raised parts. These are called the conchi. Okay, and then the lower parts, this is called a meatus. Okay, so this would be a C, this would be an M. Okay, now what these do is they're going to, how am I going to write it? I'll write it up here. They're going to increase the turbulence when the air comes in. Okay, so what it does, let me make the air blue. So the air comes in and it kind of goes around like this. And it's going to make it more turbulent so that the air touches the mucosa and gets cleaned up. Okay, now my phone is ringing. Okay, the vibrissae are nose hairs. That's easy. The olfactory region is this blue region here. Okay, it's lined with pseudostratified ciliated columnar epithelium. And then there's another thing, epistaxis, or epitaxis rather. That's a nosebleed. Okay, so epitaxis is when you get a nosebleed. So it usually occurs, these have lots of blood vessels in them, the concha and the meatus, so it bleeds there. I feel like I'm Russian. Okay, now I'm not going to require you to know all the cartridges of your nose. A lot of you will know them. If you get piercings, they talk about that the piercers know the cartilages. Okay, now we're going to talk about the pharynx next. So what we're going to do is we're going to start at your nose and we're going to work our way down through. Okay, now the pharynx is basically your throat. Okay, so describe it as a funnel-shaped passageway. It's posterior to the nasal cavity, okay, and it's behind the oral cavity, and it's kind of like behind the larynx. Okay, so now if you don't know what the larynx is right there, and your larynx is your voice box. Okay, now the pharynx is divided into 3 components. So the first part is the nasopharynx. Okay, so that's the most superior, and it's right behind the nasal cavity. Then we have oropharynx, which is right behind the mouth, and then the laryngopharynx, which is behind the larynx. Okay, so these become important if you have to do, if you have to tube somebody. So if you have to do like an NG tube, you're going to go in the nasopharynx and then out. Or if you're going to put a tube in somebody's mouth, right, you need to know these parts of the pharynx. Okay, now the side walls of the pharynx are composed of skeletal muscle. Okay, and we just talked about the parts. Okay, now on this picture you can kind of see the concha better. So let me get the eraser. Okay, so get the eraser out. Right, so if you look here, so here's a raised part, there's a raised part, and then the lower parts, that's a meatus, and those are for turbulence. Okay, so here I have more words about these parts. Okay, so there's the nasopharynx. Okay, so posterior to nasal cavity, superior to the soft palate, pseudostratified ciliated columnar epithelium. It's only for air. Okay, so normally food doesn't go down your nose. Sometimes it does, but most of the time it doesn't. Okay, now it does have tonsils in there. Okay, so the tonsils are part of our immune system. There are tonsils called tubal tonsils near the auditory opening, so near where your ear is. And then there's also pharyngeal tonsils, which are back on the posterior wall. And when they're enlarged, that's when we call them the adenoids. So people say, I'm getting my adenoids removed. So that's their pharyngeal tonsils. Okay, now oropharynx is posterior to the oral cavity. Now it's a little different, right? Because food can pass through there. Okay, so it has non-keratinized stratified squamous epithelium. Okay, so different. Okay, it's got 2 sets of tonsils. So it's got palatine tonsils on the side walls, and then lingual tonsils at the base of the tongue. Okay, so now why are tonsils important? Okay, so what we eat is not sterile. So the tonsils they have immune cells, so lots of white blood cells. in there, and they're going to destroy pathogens that come in. So it makes sense, right? Okay, the laryngopharynx, so posterior to the larynx, food and air again, and it's non-keratinized stratified squamous epithelium. So it's a little bit different. Okay, but lots of layers because there'd be friction from the food. So let me write that down. So layers of cells, right? Food is going to rub the sides, right? So food is going to have friction. So you need other layers there. I hope you guys can read it. All right, so here's another picture. Okay, so concha, increase the turbulence. Okay, nasopharynx, so there's pharyngeal tonsils. There's where the internal auditory canal opens. Okay, and tubular tonsils or tubal tonsils are right there. Oropharynx. Hyoid bone, I know you guys have talked about. The front cartilage of the larynx is called the thyroid cartilage. Okay. Remember the trachea. This is the tube for the air, and it's anterior to the esophagus, which is the tube for food. Okay, so we're going to enter into the larynx. That's where we're going next. Okay, so the larynx, it's the voice box. It's between the laryngopharynx and the trachea. Okay, so it's an air passageway, so normally it's open. And what it's going to do is it's going to prevent food, okay, or ingested materials, so food and water, from entering the respiratory tract. Okay, so we don't want to get it in our lungs. Okay, it's got this part that's called the epiglottis. Okay, and when we swallow, the epiglottis is going to close off the trachea. Okay, so the larynx is also responsible for sound. Okay, so the vocal cords are part of it. It can increase, the larynx is also going to be important when we need to push. So think about having a baby, okay, and they say push. So you take a breath and you close your larynx off, okay, you close off your vocal cords, and you contract your abdominal muscles and you push down. Okay, so that's actually called the Valsalva maneuver. So that's when we push down. So it's going to facilitate urination, defecation, childbirth. Okay, so that makes sense. Okay, now parts of the larynx, and you're going to go over these in lab. That looks pretty complex, so let's just go over a couple for right now. Okay, so here's the epiglottis. And the epiglottis, I always think it looks like the lid of a toilet, okay? And it's going to, and it's easy to see on the model, it's going to close off the trachea so nothing can get in there. So epiglottis. Okay, hyoid bone, pretty straightforward. We don't make you learn that one. We learn thyroid cartilage. Okay, so thyroid cartilage is this cartilage right here that has the laryngeal prominence. Okay, so if you think about a guy and his Adam's apple, okay, that's the laryngeal prominence of the thyroid cartilage. So that's the part that sticks out. I'm not making you learn this muscle. Okay, and I'm not making you learn that muscle. Okay, now the cricoid cartilage, this is the most superior tracheal ring. Okay, and it becomes important if you need to do a trach on someone. Yeah, that's what you're looking for. Okay, so it's the top of your trachea. Okay, and we don't go over that, but you need to know trachea. Okay, so the trachea is the tube that's going to take the air down. Okay, so you don't need to know that. You need to know these two. Okay, so the corniculate is on the back. And on the models, they're real easy to see. You don't have to know the muscle. Okay, and you don't have to know that. Okay, you're going to look at the models in lab. It'll help to put your hands on it. Okay, now, if you look inside, okay, so if I took a scope, so like if you did an endoscopy, okay, I took a scope and put it down into your throat, okay, and I started looking into your larynx, okay, what you're going to see, okay, so here's the tongue, here's the base of the tongue, okay, so this is the anterior. Okay, you're going to see, here's the epiglottis. Okay, so there's the epiglottis, and it can fold over and cover this up. It can cover this up when it folds down. Okay, let me erase. Okay. Okay, now what else you're going to see is you're going to see the vestibular folds. Okay, so these are the vestibular folds, which are out here. Okay, and then the vocal cords, which they're calling vocal folds now. These are the vocal cords. So when air passes through there, it vibrates them, and that's what's going to make sound. Okay, now the rima glottis is the hole. Okay, and the cuneiform cartilage and the corniculate cartilage are attachment points on the back. Okay, so in this one, the vocal folds are closed, and on this image, they're open. Okay, this is where sound comes from. Okay, the extrinsic muscles of the larynx, we don't make you memorize all the muscles, but the extrinsic muscles of the larynx, what they're going to do is they actually connect to the hyaloid bone, and they're going to elevate the larynx so the food doesn't go down the trachea when you swallow. And we'll talk about swallowing when we do the digestive system. Okay. All right, so the trachea. Let's get to the trachea. So the trachea is the windpipe. Okay, so it's the tube that's going to take the air down to your lungs. Okay, so it's flexible, but it's slightly rigid. One of the reasons, I don't know what I did here, one of the reasons it's slightly rigid is because it has cartilage. I'm going to spell cartilage wrong. Cartilage rings. Okay, and the cartilage rings are C-shaped. Hold on. I forget I have an eraser now. They're C-shaped. Okay, so C-shaped means, right, shaped like C's. So like this. They don't close in the back. Okay, these cartilage rings are made out of hyaline cartilage, and you might remember that from Bio 103. Okay, so I have anterior to the esophagus, posterior to the sternum. Okay, so about 13 centimeters long. Okay, now, here's the rings. Okay, and then there's going to be muscle connecting them. Okay, but on the back, there is more muscle. Okay, and that muscle in the back, okay, is going to go all the way down. That's called the trachealis. Okay, and that's smooth muscle. Okay, now, the rings aren't closed off because what if something gets in there? What if you accidentally swallow? Well, no. The rings are not closed off because of the esophagus. Okay, so the esophagus, let me make the esophagus blue. The esophagus is posterior to this. Okay, so it's back here. There's the esophagus. So if someone swallows something and we need room to expand, okay, it's going to go into the trachea, and that muscle, that trachealis muscle, will kind of move. Okay, and the rings are to keep the trachea open. Okay, so you could think about a vacuum cleaner hose. Okay, so the vacuum cleaner hose, you know how it has metal rings in it to keep it open? It's kind of what the trachea is. All right, so here's another picture of it. So here's the larynx. Okay, here's esophagus, and then the trachea. Okay, now, if we look at the trachea, okay, it splits. Okay, and it splits into where it splits is actually called the carina, which I kind of think that's cute, a pretty name. so we have a right and a left bronchi, okay, or bronchus is singular. Okay, so that's singular. Bronchi is plural. Okay, now if we look at this, hopefully you can see, so here's the muscle. Okay, here's the esophagus behind it. Okay, this is where the air is going to go. Okay, and then here's the cartilage ring. Okay, and it's all going to be lined with mucosa, submucosa. Okay, and on the outside is adventitia. Okay. Now, the trachea comes down, right, it splits. When it splits, okay, it becomes, these are the primary bronchi, okay, and I just write them like this, primary. So there's a right and a left primary bronchi. Okay, the right one is going to be slightly wider, and it's more vertical, so it's going more like this. And if you actually aspirate something, it's more likely to go to the right bronchi than it is to go the right bronchus than it is to go to the left. Okay, now the cartilage rings continue into the bronchi, the primary ones. Okay, now when we get to the secondary, okay, we split again, okay, and that's a secondary. When we get into the secondary, there's still cartilage. I can't spell today. There's cartilage, but the plates overlap. Okay, so they're actually kind of like things like this going around. Instead of being C-shaped rings, they're like that, which is kind of funky. Okay, and then when they split again, okay, that's tertiary. Okay, so tertiary actually go to bronchopulmonary segments, which we're going to talk about in a minute. Okay, so there are 10 tertiary segments on the right and 8 on the left. Okay, so the right lung has 3 lobes, and the left lung has 2 lobes. And it's because of the location of the heart. Okay, so if we look here, this is trying to show you how the bronchi divide. Okay, so here's trachea, primary, main bronchi. Okay, and then they subdivide, and they go into lobar, which we used to call secondary, and then segmental, which are the tertiary. Okay, and up here they're trying to show you them in different colors, so it kind of looks like a tree. So there's right and left, okay, and then there's the lobar, there's the segmental, and then these little smaller ones don't get names. Okay, now on here, here's 1, so 1, 2, 3 lobes on the right side, and 1, 2 lobes on the left side. Okay, and the heart is going to kind of be right over in here. Okay, so here's another image, okay, that's showing the cartilage rings, okay, and then the plates. Okay, now when we get down to the really small ones where we're starting to enter the respiratory zone, okay, which is where gas exchange is going to take place. Okay, there's no cartilage. Okay, that's what's different. Okay, respiratory bronchioles, alveoli, no cartilage. Okay, so down here, these small ones, they have smooth muscle. Okay, so the bronchioles, the respiratory bronchioles have smooth muscle. So what can happen is we can change the size. Okay, so we can have constriction and dilation. Okay, so now bronchioles, no cartilage. Okay, so they're even smaller, right? So they have smooth muscle in them. They can constrict and dilate. Okay, now they're going to go into pulmonary lobules. Okay, so I'm not worried about, don't worry about that. Okay. Okay, terminal bronchioles are the end of the conducting zone, and respiratory bronchioles, this is where gas exchange is going to take place. Okay, and that's it.